Joseph, welcome, and tell us, in the short version of things before we then zoom out, what is Circle today?
So Circle is a company that operates in the Medicare and Medicaid space. And for people that don't know, that's health insurance that is for seniors and for low-income individuals. I think one thing just to know that's interesting is that the U.S. has one of the largest socialized healthcare systems in the world. And people don't realize that. There are about 170 million people that get their insurance through some kind of government-sponsored plan. The challenge for them is that they're doing this as individuals, and it can be really complicated to try to figure out how to navigate that system. So we started the company with the intention of helping seniors, consumers, to navigate the healthcare system. What we ended up building, what we realized was the problem with what consumers were experiencing was that underneath the hood of healthcare, the systems just don't work very well. So we ended up building a platform that is actually sold to health insurance companies, to healthcare providers, that helps them, from their perspective, to sell more of their product, to get new patients, to get new members. But from our perspective, it's helping to solve the real data flow issues in healthcare that result in consumers' confusion.
Not to jump too far ahead, but I love that story as basically the way I heard it as a fellow founder is you went for it on the consumer side, then you realized actually there's an incentive aligned to other party or other parties that might be really helpful as a channel to still achieve the mission, but be more effective in the go-to-market, which is really interesting. We get to get a little more practical on the today product. So who does it specifically, or who are some of the folks, if you can name them as parties that it helps with which processes in particular? And I know, again, this is part of my fascination we'll get into. There's a lot, so maybe some of the hero ones.
Right. So we sell our product to health insurance companies. So these are like an Aetna, Blue Cross Blue Shield, just the same names that you would have heard. The only difference is that these companies are getting paid through the government. So it's a little bit of a different model than what you get from your employer. And then we also sell the product to healthcare provider networks. So if you think about a One Medical, if you've heard of that, they were bought by Amazon recently. That's the type of company on the provider side that we sell to. The platform itself does a lot of things, but the way to think about it is from the very first touch point, when you are out there looking for a plan, part of the platform helps attract new people into that process. The second part of the platform helps a sales agent who works for a health insurance company or a provider to actually do their work. So it's kind of like Salesforce, but for healthcare. Third portion of the product manages all of the back office functions for sales and policy reconciliation. This is where it gets very boring and I go to parties and people's eyes glaze over. But it's really a critical element to making the system function. And then the last piece of the product, so if you ever try and call your health insurance company, that I'm going to go ahead and go out on a limb that it's not been the most
positive experience on the planet.
Yeah. So that part of the product, or for instance, your health insurance company sends you mail. I don't know about you, I never open it. It's just straight to trash, and hopefully they're not billing me for something.
They also send a lot of it. It feels like especially as an employer, now that's the interesting side of the employers, will get mail addressed to certain employees sometimes from the health insurer. I'm like, why is this coming to me?
Yeah.
Why does it happen every month sometimes?
Right. And there's no coordination of it, and they don't know, maybe as a business, they should just text you if there's something important or whatever. Yeah. So our third or fourth part of the product helps them understand how to communicate better. And it actually enables that communication to happen. So if we profile you as a person who's only going to respond to text, then you're going to get only most important text communications will get sent, and then maybe everything else is in your portal. So looking at how do I get a higher response rate from people and help them to actually understand what's important, maybe help improve the NPS score of an health insurer. So we'll see.
Along the way. It's really interesting because this whole idea, there was actually a startup that pitched on a show we have about very early stage startups where they've got a minute to pitch and get some feedback. But it's coming to mind for me because the really great story that we wound up discovering when he was on stage, it's called RX Care. And what he's trying to do is I'm such a idiot for this, but Medicare and Medicaid confuse me in terms of the terminology. Which one is for older populations?
Medicare is for seniors, yeah.
So it's Medicare. He's going for Medicare Part D participants and going through the agents. And then the whole thing is like being an AI chatbot where it can talk to the consumer on behalf of these agents. And the whole concept being the sign-up process is really bad. A lot of people's issue, if they're trying to get care, is actually they're not compliant. They don't have the patience to sign up to fill out the forms. The agents want them to, but the agents obviously have 1,000 people they're trying to do that with, and the technology isn't great. And so again, the concept there was this AI chatbot to help that registration. I feel like that's a little bit overlapping here, where essentially, again, like the barrier to care is almost the people themselves, not in a malicious way. People want the care, right? But like to access is really difficult. There are people in the middle who also want the access, but are busy, overwhelmed, don't have the tools, whatever it is. But let me zoom out for a second. It feels like this problem is somewhat exacerbated by, you've mentioned it's many providers or types of, medical startups or solutions. Is part of this challenge that this is different state to state? Is part of this challenge that it's majorly privatized or government subsidized, and so there are a lot of different people running their own operation? When we go to the core of why it is the way it is, other than just life, right? Because we can say, okay, great, people have created processes and over time it's gotten complicated. But other than entropy, there's something else probably that's caused this. What is it that makes this so damn convoluted and then again has a web of participants?
Right. Before I answer that, Gustavus Smith, he was one of my first employees. So it's a
that's the founder I was just talking about, who was on our stage on the feedback loop. That's amazing. That's fantastic.
Yeah. So he left and started really honing in on this one portion of the process that is an acute problem with like medications. So
what a small world.
Small world. So if the question is why is healthcare complicated and the way that it is, I think the first thing to know is that although people don't think about it this way, healthcare is complicated everywhere. Managing and understanding how to cover your population is difficult everywhere. There's some portions of Western Europe where maybe things are a little bit more streamlined, but in most of the world, healthcare is a really complicated process. The U.S. is not unique in that, but we're also 50 states. Each of them are have very different value systems, have a different history of how healthcare got started in that state and how the coverage started. So there is a big difference that we are a big company that has lots of competing, almost mini countries within it that's created some of the challenges. The other thing is that healthcare in the U.S. was started as small businesses. There are 900,000 companies that operate in healthcare as separate entities. And a lot of the push to maintain privatization in healthcare was because people wanted to protect the interests of small businesses. So you have these conflicting value systems of on the one hand, it's like I want to support the small worker, the mom and pop physician, or just a small local pharmacy, and then on the other side, you have big business that got involved in it as well.
Probably in the mid 1900s? Is that like when things? Because by the way, that's the first time I've heard.
Much later, actually.
Okay,
yeah.
But that's actually really interesting. I love when we get a lens like this. That's not a story I've ever heard told. This idea that like the origins of this come from, it might be well told in health tech, but like come from protecting the mom and pop, the small business, because that creates a lot of this, to your point, these competing priorities. So basically at a point at which healthcare was a new concept, health insurance was on the rise and we were as a society discovering what it should be.
Right.
This was about really maybe virtuous small businesses who needed to exist in small formats. It was about the local physician or the local hospital, the local surgical center, local pharmacy. And we've transformed away from that without maybe updating a lot of the value system, not value literally in terms of healthcare value, but the value system in terms of how we think about, do these people need as much protection, intervention, regulation?
Yeah, I mean, I think that that's a big part of it. I think also understanding that the origins of all this started in the same way in Europe as in here, where the initial forms of health insurance were just disability insurance for employees in Europe also, not just here. So And we diverged for a number of reasons, but a big portion of it was this protection by AMA and other policy groups that wanted to look out for the interests of the individual doctor or physician. Yeah.
So the point at which big business gets involved much later, and now we're here, that convolution manifests too, it sounds like, in like a lack of any standard process, right? Like that's the other issue we have. It's not just that we have all these parties and all these businesses, but now we're in a spot where something like Circle seems to be, because there are no central tools. There's no centrally enforced process or anything like that. Let's get to that portion of it for a sec. So what is your product competing with?
So each module, so our product is sold kind of like if you've got HubSpot and you log in and there's like a bunch of things that are turned off, but you only licensed one piece of it. So it's sort of sold in a similar type of...
Right, on your landing page, it's like different Circle options and products. So you can get CRM, you can get billing. I don't know if those are the two separate ones, but that's the thing on the landing page that you get pretty... It's well communicated that it's like modularized products.
Yes. Yeah, exactly. So each of the modules were competing against a point solution that's out in the market. So they're
a monopolistic one. Like, are each? It depends probably on the module, but are you competing in each one with like a category owner that is old and legacy and has most of the market but shouldn't, or is it 5 of them and depending on the provider you're hitting, you have actually like a wealth of competition?
There are usually in each category about 2 competitors. Most of them have been around for at least 20, 30 years. All of them private equity owned companies, very entrenched in the market. So that part of it is definitely really challenging because we're coming in saying, hey, the dream with us is you get the entire thing over time. You don't have to do the whole thing at once, but whatever your problem is, start here and then you'll get it over time. But we are competing against companies that have been around for, like I said, 20 years and have got 1,000 employees, and we're 20 people. So that part it's definitely...
Well, it sounds like you could have gone 2 ways. Tell me if this is like an inflection point or if I'm, if there's a different inflection point than the one I'm identifying. But I imagine, since as a founder you went consumer first and tried to, kind of approach them directly, before you went B2B sales, marketing, and billing enablement, you probably had a moment where you said, I could instead just make this a lot more servicey, be a tech-enabled business and become a provider or a broker or agent or whatever it might be. Like, you could have said, hey, I want to own these relationships. We're going to do marketing. We're going to create cost of acquisition. We're going to compete on that. We'll find a proxy for services on the back end or white label services on the back end, and we'll be the brand.
Right.
And Circle will be the thing that people go for. Or there are all these individuals out in the world who want to use these tools, who are already trying to get customers, who are already trying to build those customers, organize them into proper policies, and you decided on this one. Was that the inflection point? What was that decision like? What was the matrix of pros and cons?
So the first inflection point was, so my co-founder and our office was just 2 blocks away from here. I decided, okay, we're going to launch this product that does plan comparisons for all Medicare people. It's going to be unbiased, unconnected to health insurers. We're not even going to think about how we're going to get paid first. So we built this thing out, worked really well. It was a great product. Launched it in New York, and the a Department of Financial Services in New York in 1 week contacted us and said, you have to take this down.
Oh.
And we were like, what?
Yeah.
What are you talking about? And we said, we're not making any money off of it. We're just providing free information. And they were like, here are the 10 regulatory reasons why you can't just do that. And
what's the generous interpretation of those regulations? What are they attempting to protect? Because it sounds to me like that's a website that if I'm in that moment of buying, I do want a plan comparison. I want it to be not the parties themselves. I don't have to call 10 people. So what's the intended?
Okay, so the intent is, so you have the Center for Medicare and Medicaid Services. they are overseeing this massive market. They kind of pass down the need, like oversight and regulation, to the health insurance company. So the health insurer is responsible that they're selling products correctly, legally, whatever.
Oh, interesting.
And so in order for you to put something up, it has to be approved by the health insurer because they're the ones that are responsible for information about their products being displayed
Are they being
correctly.
also actively approved by this center, or is it just that the center has an enforcement ability on the insurer if they should misrepresent themselves? Is it an active thing? Like, let's say I'm one of these insurers. Does the center also approve all of the marketing material?
So you get it, you submit it to the insurer, who submits it to CMS, Center for Medicare and Medicaid Services, and get approval, and then that's how you're able to display anything online. So it's so it was a kind of a wake up call of this market's obviously going to be a little bit more difficult to address. And at that moment, we could have said, let's just become a brokerage. And the reason, and so that would be going direct to consumer and just being like, well, we're going to open up a hotel and like we'll be the ones who just offer the best service and have the highest quality hotel. So that was an option. But what we started to look at was like, well, is that actually solving what we're going for here? What was our original intent here? And that was not to help a small subsection of people that happened to encounter online to get better recommendations, but to actually solve the problem of why people can't navigate healthcare properly. And for us, the way we think about that is like, instead of building the hotel, we realized that the pipes throughout the system didn't work. Like the water was never going to come into that building properly. And so it didn't matter how nice the hotel was. If you didn't fix the pipes, then it's still not going to be a great experience. So we decided to focus on that portion of it with the idea that people could build anything on top of that. And hopefully that will lead to sort of longer term
and larger scale.
Larger scale, be able to touch more people and have it be ideally embedded enough in the system that it doesn't get displaced easily, so that it has long-term effect and change.
Founder to founder. How often do you think about that decision? Is it working out so far? Founder to founder to founders.
Yeah. No. I that decision I feel like was 100% the correct decision. Although the faster path to having like a profitable lifestyle business is to do the brokerage. And that's the direction. If like you just want to, if I wanted to do that right now, we could start that and it would be up and running and do well. There's no question about that. That's not the kind of thing that I personally can live with, which is maybe a fault. Or maybe life might be
Founders
easier.
Founders are screwed up. It's a thing that we all share in common. It makes sense.
Yeah. I would say that the thing I more question is, why have I chosen the most regulated industry and to do the most regulated part of that regulated industry? So I question my life choices.
Well, if it provides you any comfort, I feel like every founder, I am a founder who's in like a high-end consumer job search platform, and I go, man, a B2B SaaS company would be easy. So we all have it, right? I'm sure the B2B SaaS founder is going, well, that would be easy too. We look across the pond. But that's an interesting portion of it, because I think one of the things that's really unique and what I would find challenging about your business, because that's how I view the landing pages sometimes when I'm thinking about, okay, what's interesting here, is you are not only doing something in a highly regulated space, the amount of touch points, because I think the mission you have is extraordinarily large and has a lot of different individuals who can decide any given day not to care about what's going on, right? It's not one solution that is just clearly 2,000 times better than the one other solution someone uses today, right? If I can get you to use Claude instead of ChatGPT because the language today in one of the models is so much better, that's obvious. For you have to convince a lot of people that a lot of their net profit over time or their NPS with their customer or their matchmaking for their patients will be better over time if everyone in their org or several parties in their org adopt Circle. How do you tackle that from a go-to-market perspective today? You said the team's 20 people today. From a early stage founder approach, that's, I think, one of the other hardest things is until you have that large implementation team and large sales team, it's not easy to adopt, probably. It's not easy to adopt Circle, not from a technical perspective, but you probably have to really convince an org, hey, take this on as a project.
So this is one thing that in the beginning, that was a problem, and we shifted our go-to-market strategy in a couple of different ways that have made that a lot easier. So we think about we're selling along this entire journey or circle, as it were, of what the health insurer or the member is going throughout the year, and each organization we go to is trying to they have to do that process. Every single organization. Each of them is going to feel that they've got an acute problem in that process, and that is the thing that is holding them back from growth.
Some of them, it's acquisition of a patient or customer. Some of them, it might be proper billing reconciliation.
Yeah.
Some of them, it might be policy matchmaking.
Yeah, or eligibility for Medicaid. It could go down to something very, very small to we need to change the entire direct-to-consumer and sales agents process to we just need to make sure that people that are buying our products are eligible for it. So we can go down to the tiniest component or wide adoption. And you always have to you're selling to a person. So in this case, there's usually a bunch of decision makers, but because the businesses are so siloed, you have to really understand what the profile is of the type of person that's going to buy that specific module and target based on So
it's a land and expand where you're targeting one module first based on the customer's biggest pain point. And then you'll say, great, after 6 months or 3 months, we're going to have the conversation with you if you're happy. There are 5 other modules, 6 other modules you can buy.
Yes. Now that's where the part that is challenging is that because health insurers are so business siloed and have really different budgets, you have to start not just trying to upsell, but build relationships. Also, nobody buys from me unless they know me, that they can look me in the eye and say, I went out to dinner with you, we had fun, and I trust you, and I will buy this. So even selling within the organization, there's a lot of work that goes to building your relationships with the other business units. And these are multi-billion-dollar businesses, so you got to find the champion in the other business unit, which is challenging. And also it's an industry where people move around a lot.
Yeah.
So you'll get to the finish line and everybody's on board, and then
someone gets poached to another one of them.
Yeah. And then you're well,
the CFO changes.
And it's not they just pass that project over to somebody else. You just that's dead in the water, and then you hope that wherever your person landed, they'll start the process there.
Yeah. You went through a rename.
Yes.
So it was Trusty Care. Now it's Circle. What was that about?
So I'll give you the honest response to the branding. So we started the company, obviously direct to consumer, Trusty Care. We thought it was a good name for that. We kept the name because it's rebranding is kind of a pain, and we thought honestly that it didn't really matter. Our customers are health insurance companies; they're not particularly great at their own branding, so we're just whatever. And about a year ago, one of our customers came to one of our board members, and they're really close friends, and he said, I would buy more of their product if their branding wasn't just so terrible.
And wow.
And he's their presentations, I can't sell them to other people. Their name doesn't make any sense. And instead of being offended, we were well,
You know what
Okay.
insight I love about this, though? This whole idea, I feel like a lot of startup founders go through this, where if they have a more regulated customer base or a more legacy customer base, they have that exact process you did, where they think they won't care. This is more of a hand-to-hand combat sale. I'm going to go sell them whatever I name my thing. Doesn't matter. But this is, first of all, kudos to you for like taking that, kind of feedback so well. But as soon as you said, I was like, of course it matters, right? Because people have to. These decisions are more trivial. My team makes fun of me. A common phrase I say is, "Everything goes with the wind." It's just like, if I wake up one day and I'm mad, I'm gonna not hire somebody. If I wake up and I'm happy, I might hire somebody.
Right.
And that's the difference. And the same thing in a purchasing process. Just the vibe of a name can mean the difference between. Wow, that's so interesting.
Yeah, and in the process of figuring out the branding, we were talking, and they were pretty clear with us. They were like, "You need to feel like Salesforce." Like,
right.
Period.
Right.
And they're like, when I go to another business unit, I want them to feel like I'm bringing Salesforce to them, like on that quality level. So that was helpful that they were so explicit. But we thought about the name a lot, and we were trying to come up with like all sorts of creative names. And then we noticed in any meeting that we went into with a customer, when they would when they got it, what we were doing, they would all be like, "Oh, so you do the whole process for us?" And at some point we were like, "Wait a second,
everyone keeps doing this."
We're like, "We're not that smart, but this seems like this might work."
I love that. Talk to us about bringing the team along for the pivot. How big was the team? At which point that inflection from D to C became the sales force for this space. How big was the team? What were the hard conversations? What was that time like for you as a founder?
So that pivot point was early enough on that it was actually not that challenging. We didn't have a lot of people. I think we were probably 6 or 7 people at the time. The more challenging, it was more like market pivot, customer profile pivot. About 2 years down the road, we had been selling directly to brokers. So these are like sales agents for health insurers. And we decided to start selling directly to a health insurance carrier. And we didn't appreciate how different a sales cycle that was and how different the profile of the customer was going to be like. We were like, we're selling to the sales section of the health insurer and we're selling to sales agents of health insurance. How hard could that be? Very hard. It was completely different. And the profile of the people that we needed to have working at the company was completely different. Like, you go to a broker conference and I feel like it's inappropriate even if you're gonna to even talk about the kind of stuff that we've seen there. It's just
right.
insane.
A legacy industry sort of thing.
Yeah. Like just they're like living in 1985 is like how I like them a lot, but it's just that's the reality of it. Then you go to like a health insurance conference, and these are professionals, and it's just a very different. The whole thing was different, and we had to have a lot of changeover of people who would be attracted to selling to that type of an audience and building for that type of an audience versus building for like this really regulated, like often the people we're talking to are real nerdy, like policy kind of people.
Not very technical.
No, not very technical.
Very bad at using the product. It's interesting that you say that because like oftentimes that's the difference between who works at a company like a Salesforce, because that's not probably an exciting company for a developer or product manager, because so much of building that product, people make fun of it all the time of like, oh, it's hard to use. Why does anyone use Salesforce? The truth is, it's really valuable for everyone who uses Salesforce, right? Like there's a reason they do as well as they do, but it's not the most innovative product to build. You're not building swipe interactions,
right?
And your activity in building new product is integration heavy, probably, or things of that nature.
Yeah,
that's really interesting.
Yeah, and we're finally getting to do some of the fun stuff. We have a direct-to-consumer portion of the product now, so we've come kind of fully around where the product is used by consumers, but still it's licensed by these health insurance companies.
So it's kind of like a B2B2C.
Yeah. And our sale is still B2B, but yes, the consumers are the ones using it. And And so now we're getting to do some of the fun stuff we wanted to do in the beginning, just a different pathway.
The better UX, the better experience for the true patient.
Yeah, exactly. And so that does attract people who want to do something fun, but for a long time it was a hard sell.
How much have you raised?
We've raised just about 17 million. Yeah.
Talk to us about the relationship the company has to venture early on in this change, today, and tomorrow.
So I've been raising capital for 20 years with different companies that I've owned. And I've taken a different path than a lot of people do in raising capital. And usually I start with the same angels that have invested in me multiple times. So these are family offices or angels that have been really consistently backing me over the years. So we raised our first probably 3 or 4 million just from individuals and family offices to get us going. And only once we got traction in a way that I felt was meaningful did I start bringing it to the venture world. And venture, as I'm sure everybody here knows, has been a wild ride this last 7 years. Having been in it for a very long time, it's been shocking even for me, both the upset and the downs. So when the market was really hot, we went to venture and were able to raise a significant amount at that time. Even though they looked at us and they were like, this is not the most exciting thing to sell to my people. But raising capital is, I consider it probably, for a CEO, if you're running a venture-backed company, it should be like your job is keep the company capitalized. So it is a big part of what I do, and I don't know. It is what it is.
It's interesting because I would assume, are there health tech VCs that are primarily your anchors, or is it generalist software investors?
We do not do well with health tech investors.
Interesting. Say more.
Okay. I feel like I can get on stage and do a TED talk about what we're doing, about the meaning behind it. But what we are actually doing is building technology to help health insurance companies to make more money, to improve their top line revenue and improve their margins. Most healthcare investors are not interested in you telling them that what you're doing is going to be just making the health insurance sector make more money.
But not because they're virtuous, right? Because someone could interpret your sentence as, because they have a broader mission they're on. I'm sure that's true for maybe some of them. They think that. But I'm going to guess because they're looking for things that sound more disruptive immediately. They don't get how what you're doing could change. So if the top line of all these insurers gets better and their bottom line gets better, that means the customer is going to get a better experience. A lot of the reasons that we live in the state we're in is because of the economics of the business, or am I misinterpreting the entire thing?
Sometimes it's because they have a direct thesis, which is there's hundreds and hundreds of venture funds in this sector. So some of them, it's a thesis of we only do things that are directly touching consumers. It's got to be something that is the primary value is managing diabetes or something very direct. But a lot of the time, we get really clear feedback that so you're supporting the devil, you're.
Do you see it? It's interesting. I'm gonna guess, because you know more than most, that you could probably articulate a better vision of why they're the devil than the person who says they're the devil. What's your view on whether insurers are the devil, whether the people in this... I mean, you can't say they're the devil. That'd be ridiculous as a founder to say. Right. But I guess, what's your view of their view? Do they have it wrong, or are they just wrong in how it can be changed? And they're not as optimistic. They're not as optimistic as you that actually there's good ingredients here. It just needs to be put together the right way.
The deeper I go into this, the more profound the information asymmetry is observable to me between how things actually work and how people think they work in healthcare. And if somebody asks a question like that, to me, I'm just okay, so there's a big gulf between how you think the world works, but specifically how you think healthcare works and what's possible. And it's easy to break down why it doesn't make sense that health insurance is just the enemy. If you go to a country where there's no health insurance, like, first of all, you take a step back, but like, why was health insurance created? It was created because people had to go directly to a doctor and the doctor could command whatever fee that they were asking for. And the initial aim of it was like collective bargaining pushed by unions so that you didn't have to interface directly with a doctor, but you had an intermediary. And I think, and so in some countries, the government's doing that on your behalf, and nobody looks at that and says, oh, like how devilish of the government.
They're middle
to do
people.
This.
Why are there middle people
We don't
here?
need a middleman. Like, of course you need a middleman.
Yeah.
Like, the question is, should that middleman be a private entity or not? And that's like, really, there's lots of room for debate, but almost every country in the world has a large privatized health insurance market. So I guess the answer to that question is, I don't think any of these companies are the devil. I think they're just companies, and they're doing their job. And if you give them the right incentive structure, you can get them to do different things. And we've tried out in the U.S. almost every single incentive structure you could possibly have for healthcare. And some of them really work in getting, like, if they're like, if we'll make more money to get you healthier, sure, we'll get you healthier, you know? It's just you have to set it up in a way that is meaningful to what matters to a company.
Two things that are fascinating to me about what you said. One is, as a founder of an agency, I deal with this too. People will say, so we provide Hollywood-style representation to tech talent. And they go, oh, so you charge the tech talent? Yeah. So you just are garnishing their wage, or like you're a middle person, you're a different version or a flavor. And I go, okay, here are all the things we do for a person. Job search automation, network, interview coaching, negotiation support. In what world will a job seeker, we can debate what my price should be,
right?
But in what world does someone who sits at home and over the course of 3 months lazily applies to 7 jobs and winds up settling for something, how are they better off without me?
Right.
I'm not saying that someone who does all the right things shouldn't do it if they can do it.
Right.
If they can sit there and do it the right way, sure. But they're in an optimized market where the existence of a middle person actually could do a tremendous amount to solve information and process asymmetry problems that currently, kind of like back when doctors could have had any price, really put the talent at a disadvantage. So I find that fascinating. I just wanted to share that. The second thing is, I've been hearing this theory, and it really strikes me here. It's about politics. It's about people's skepticism of technology, about the magic box. Have you heard about the magic box at all?
I don't know.
Anyone else heard about the magic box? Maybe one. So the whole idea of the magic box, so everyone's skeptical of a lot of things right now. And they have conspiracy theory brain, or they hate and think of insurers as devilish. And the magic box theory is that as life has gotten more complicated, our ability to basically insert intention has really increased. And the great example of this that I love, back in the day, you had an abacus and you could see math. Math was things that were moving in front of you, and you couldn't really disbelieve that when the things on an abacus would move, that was how math worked. Whereas today we have a phone. And so if you tell me that your phone is recording you, I have to understand why you think that is. And usually it's because you don't understand how a phone works.
Right.
And so your ability to infuse a bunch of intention and a bunch of malice into the story of whatever's happening in the phone, it can only be fought by my ability to now explain to you, well, do you understand how networks work? Do you understand how phones work, how operating systems work, how that could be traceable or trackable? There are a couple political streamers in the space right now who are using this magic box theory that I really find compelling. I feel like our relationship to healthcare, I'm curious your thoughts on this, as consumers, would be better off if we were less in this magic box, right? We might still want the system to change. I'm a leftist center liberal who would love a more universal healthcare system in the US. Sure. But I also feel like, as the son of a physician and my sister's a physician scientist, I have more of a sympathy for the doctors in the system and how insurance works and all this other stuff. And I understand the magic box a little bit better, so I'm not as angry all the time.
Right.
Do you think that's a thing that is worth, as a society, us undergoing, solving this magic box so that an individual who's at the other end of some of this asymmetry, who might be experiencing bad outcomes, that's a thing we want to solve, but they wouldn't be so frustrated and we could all get along better? Does it matter?
I think it does matter. I mean, it brings up a lot of questions, but so just as an example, in a lot of places in the world where a consumer is not experiencing, for instance, surprising out-of-pocket costs, right? How is that happening? It's not magic that it's that they don't experience that, and it's not that those countries.
Taxes.
Well, it's taxes, but they actually they're spending less, right? But the negotiations of what that consumer can get are done ahead of time. So like on their menu of what's possible for them to get is not 10 MRIs, right? If they just feel like that they want them. In America, we've taken like a different stance where we want everything that we want when we want it. And we want to not experience the out-of-pocket costs for it. So to answer your question, in other countries, there's more alignment of expectation of like, if I go to a doctor, they're not just going to give me everything I want. And so there's satisfaction in that, and that like I don't experience any cost as a result of that. And here, because our expectations are up here, but then like we don't really have the finances to cover it, there's a huge amount of dissatisfaction there and confusion about that. So do I think that you could change Americans' relationship with like American exceptionalism and our desire to get whatever we want? I don't think that that's like, I think that would be a very tall order.
We should. That's somewhat what I hope even like, Founders Friday does for people, for founders, is to inspire them to build the thing and understand how to do it. But hearing from a founder like you about this stuff, I hope it's a small quarter thrown in the pond to say, well, there's more here. And if you want it to change, here's what else needs to change.
And my dream on this would be that the policymakers become more informed, and that you never have to think about how it works, but that it just works for you.
Right.
And I'm not a believer that people should have to understand the nuances of the system, but some people have to.
Right. And that's the whole point of a representative democracy, isn't it?
Yeah.
Or it's supposed to be.
Yeah. But it's so polarized in the language. And I hear this on the left and the right. Like I read both sides on this issue because our customers are both sides and the consumers are both sides, and you need to serve everybody. There's just as much that the right and left are getting wrong about how the system works and how it could be improved. And a lot of that is we've just become entrenched in our camps without thinking about what is it we're actually trying to solve together.
Yeah. If you were going back in time, or let's say that someone gave you, $5 billion to stop doing what you're doing right now, and you were going to reboot in health tech, what's a problem that you identify today that you go, there should be a founder tackling this? I don't have the time for it, but I wish someone was.
So there are a lot of things that I would like to tackle, and some of them are have less of like a financial backing for them. And but the thing that I spend a lot of time thinking about is the U.S., like I said, is a big country. You have parts of the country like rural Mississippi that should be the level of healthcare in those types of communities is so poor and reflective of the economy of those states that it's sort of unconscionable that we allow that to continue. And if I could focus on something, it would be on the rural areas of the U.S. and how to improve healthcare.
If I use a proxy, I haven't heard anyone use this term, but like we talk about food deserts, it's almost like healthcare deserts where there's just pockets of poor care or no care.
Yeah.
I think travel nursing was a big category for a while because of this.
Yeah.
Right?
And then I'd say the other thing that I've really come to believe is that a lot of problems that people experience in their health also can be really traced back to lack of community and feelings of loneliness and isolation, and that we're seeing that at every age level. And that's not exactly healthcare related, but I think it is. Of how do we rebuild community where people are connected in real life, or at least meaningfully online?
We're finding out more than ever, I think, to your point, that like a lot of these outcomes either could be avoided or improved with community and addressing things like loneliness, things like community.
Yeah, exactly.
That's a great point. All right, well, to the crowd. Go ahead.
Thanks for sharing your thoughts today. I have two questions. The first question is, if I heard you correctly, you mentioned that when you started your company, you were trying to help like seniors. I was just curious, like after all the process you've gone through, how have seniors benefited, from Circle being around? And the second question, and you kind of alluded to this, is you mentioned policymakers being aware. Now, part of the challenge, especially in the U.S., is that we have a lot of laws that were passed for an era, and that era has completely changed, especially with the adoption of technology, and there's a big gap between technology coming out and the law catching up. How is Circle playing a role in that, and whether it's local or any area there?
So to your first question, our products have a direct impact on consumers in lots of different ways. The primary thing that we look at is reduced unnecessary cost impact to the consumer. So on average, we're saving a consumer between $2,000 to $3,000 a year on healthcare costs. That can be the difference between people picking up their medications and not. And those are really simple things. Like if you go to your in-network pharmacy, which people don't realize exists, you could be paying half as much as if you went to an out-of-network pharmacy. So making sure that people are making those types of decisions has a direct impact on them, even though we are not the ones that are going out there reaching the consumer.
Can I just add? I think one of the things that's really interesting about you're saying that because you're helping the people in the middle who are interacting with those consumers with tools, they're making it more obvious to that end person all the options, and it's already within the insurer's interests to say, be a good user of us.
Right.
And people don't realize that often. It's like good compliance and usage is actually also good for the business. That's good for the consumer. And so that's what you're really helping with, right? It's like incentive aligned.
Right.
Encouragement.
Right. Which is especially true in insurance for seniors and low-income individuals, where the incentives are aligned. Those companies make more money if you actually take your insulin, right? So, and then to answer your second question, it's really a really complex question. The government tries to partner with technology companies. You have a couple things that have happened recently. Like, just was reading an article yesterday that Deloitte had been paid $400 million to roll out this Medicaid eligibility tool across the country. And millions of people got denied Medicaid unnecessarily because their system didn't work.
I saw that this morning.
And Cerner, massive rollout with the VA to redo their entire EMR system. I think it was maybe $10 billion. I could be, don't look that up. But doesn't work, still hasn't rolled out. And so you have these, so the government is trying to partner with technology companies, trying to push things forward, but it's very challenging for them to find partners that are big enough that can actually work with them. And then it's such a slow sales cycle and so costly to be a healthcare startup that it's really challenging for you to move the needle for quite some time. So you have the most cutting edge groups that maybe can't find anybody that will just pay them any attention to even pilot their product. So so there are those challenges, and then obviously there are challenges of just lack of understanding and fear of technology. So AI, obviously a topic people are talking about. The initial rollouts of AI in healthcare have been there's been a lot of bad behavior. There was initially software that's built to just deny claims more easily, that type of thing. This has created a lot of anxiety in healthcare and with politicians around the implementation of AI in healthcare. And so now they're saying you have to make your model completely transparent. So imagine you're a startup who's trying to build an AI company, but you have to say, like, everything we build has got to be accessible to be reviewed by the government, and any changes we make. It's made a lot of these hospital systems say, you know what, this isn't worth it. Like, it's just, let's avoid the technology altogether because we don't need this for like more additional oversight. So that said, things are a lot better now from a technology perspective than they were 15 years ago when I started in this sector. So it's moving forward. It's just like a very slow pathway. Yeah.
When you think about everything that you're doing in this, the other journey you are seeming to go on is AI-ish, at least on the landing page.
Yeah.
What role do you see it, not to ask that question, but I'm gonna, what role do you see it playing for you? Again, there was enough on the landing page that I feel this is a decent question to ask, not just a generic AI. And how are you going to navigate that, on a move forward timeline too, because there might be the today answer and the tomorrow answer.
Right.
So I'm more curious about both, but mostly the tomorrow answer.
Yeah. Well, I'll also say there's the past answer as well. I'm old enough that I've gone through multiple times of AI being like the hot word and then the don't talk about AI and the hot word. So I'm glad to see AI back in the news, but we were part of original IBM Watson with my last company, anyways, not to be the old person here. But so we've used AI, which is such a broad term in the product since the very beginning. But generative AI for what we're doing is maybe like one of the best use cases out there. You're dealing with huge amounts of unstructured data that is confusing for both consumers and the people that work in the industry to understand. And they don't know how to even ask the right question to know how to get the right answer. And so I don't know if you could get a more perfect type of problem set.
And there are lots of rules,
Yes.
right? That's the other thing, because it's not just unstructured data. It's unstructured data that if everyone could have all the context in their head all the time, they could actually organize through it quite quickly.
Right.
But there's too much.
And constantly changing rules.
Yeah.
So just as an example, just like I, which is something anybody could do, I downloaded from my insurance company all of my explanation of benefits, my formulary, everything, and uploaded them. This is not related to me. This is related to the plan into ChatGPT, and now it just will tell me I'm like, can I go to this doctor? And it's like, no, they're out of network, or that medication is going to cost you this amount or whatever. And that's just something I did in 5 minutes, but there are a million use cases of how your experience navigating healthcare could be improved through this form of AI, which I find to be incredibly exciting. And I was a kind of a jaded AI person for a while. So this is, and for us, this isn't something that would displace us. It's just like we can become a vehicle to just use those pipes we've built to provide clearer information using these types of tools, which is, I think, is going to be transformative for people.
That sounds so right. And to your point, I think it's a good call to action for people who are in the space, because it wasn't obvious to me that was going to be your answer. But to your point, you don't need to displace yourself in this sort of an industry by embracing it full on, especially because of the thing that you talked about with how health insurance will be nervous, right? And so you have a nervous customer. And so I think a lot of startups have the opportunity to be the adopter of the AI or help them adopt it, whichever is best. But either you as Circle or another startup in an industry that's nervous says, okay, we'll do the AI part in a way that feels safe to you as a vendor, and in a way that, we're going to take on some of the risk, but we're also going to take on some of the work. And package it in a way that allows you to be confident it's doing what it's supposed to do.
Yeah. The one thing I would say for people working in healthcare to understand about AI is that our customers don't care about AI.
Right.
What they care about is have you created something where my customers actually understand what I'm trying to tell them? And have you created something that is going to make my day easier, my work life easier? And there's a lot of fear of AI. So if we were to go out and lead with we're an AI company to our customers, they would probably shy away. What they want to hear is that we're solving their problems. And that's one thing I think people can get really excited about it, but make sure you've got an application that your customers can actually adopt and use that is meaningful for them.
Totally. Sometimes it's even the entire back end of a solution and not at all something you 100%. Talk about out loud.
Yeah.
Joseph, this has been a fantastic conversation. It's kudos to you.
Thank you.